Good.
Yes, sir.
We'll go ahead and call to order this meeting of the City Council Employee Benefit Trust. July 22nd, 2025 at 4 p.m. To the few members of the audience, I don't know why y'all come, we're so boring. We are dressed a little bit more casual today in honor of our Jeff Harris's birthday this week.
Thank you.
We may sing later, I don't know. We'll see. Let's go ahead. Do we have any public comments?
No, sir.
Thank you, ma'am. Ms. Meismer, are you ready?
I'm ready.
Go ahead, please.
All right. We're going to talk about the fiscal year 2026 employee benefits. I'd like to introduce or remind y'all that Natalie Haskett with Gallagher is here. She's our consultant. And then Maya Johnson is also here, HR manager for the city. And she's going to be doing this next year. I promise. Okay, so the Employee Benefit Trust. Y'all are the trustees of the Employee Benefit Trust. And the Texas Insurance Code requires insurance companies to collect and pay a 1.75% tax on premiums collected. Chapter 222.02 states that if a municipality sets up a single entity benefit trust, they're exempt from that tax. And in July of 2008, the City Council approved a resolution to create the single entity benefit trust. And then, of course, y'all serve as the trustees. To date, this shows our savings to date by having the Employee Benefit Trust, and that is $860,177. So well worth having the Employee Benefit Trust. Okay, we'll get into the benefits. We did a request for proposals for medical, dental, vision, short-term disability, EAP, Employee Assistance Program, our long-term disability, life, and AD&D benefits. In your handout, you probably have KDT on the advertisement, but we actually advertised in the Hill Country Community Journal on 5/28 and 6/4. We received 18 initial responses and selected 8 for best and final offers. Blue Cross Blue Shield came in at 29.4% increase. United Healthcare came in with a 43% increase. Our average loss ratio with Blue Cross Blue Shield as of June of 2025 was 109.5%. If you remember, the loss ratio is the claims paid versus premiums paid. So we had more claims that were paid than premiums were paid in. And that includes the pharmacy and the medical claims. So this put us in a very challenging negotiation position with a tight budget. So this shows you the loss ratio per month for the previous 12 months. January 2025 did us no favors with a 200% loss ratio for that month. We began our negotiations with Blue Cross Blue Shield due to the stronger provider network in Kerrville and the stability of our 12-year relationship with Blue Cross Blue Shield. After significant negotiations, Blue Cross Blue Shield best and final offer went down to 7.7% with some plan replacement.
Excuse me. You said 7.7 and our screen says 17.7. Which is it?
17.7, I'm sorry.
That's fine.
17.7 with some plan replacement options. Those were replace the current HSA, health savings account, which no one chose, so no one was on that plan, with a HMO, which is a health maintenance organization plan. The HMO is identical to the PPO plan design with the following exceptions, and the only exception is there's no out-of-network coverage with the exception of emergency care. So if somebody is out of state and has an emergency, they can go to the ER and that will be covered in network. There's no change to the existing PPO plan, so we are going to continue to have the PPO plan as well. And then we have additional 1% savings through Blue Cross Blue Shield for bundling with our dental plan. Blue Cross Blue Shield Medical, again, this would be our 13th year with them. We are estimating a 4% increase after we do all our figuring up, and I'll give you more information about that in just a little bit, with a $50,000 premium credit based on the potential employee migration from the PPO plan to the HMO plan. And our rate history is shown here. You can see FY '24, we had a bigger increase of 13.2. We have had a decrease in 2016, but most of the time there was an increase, and we did some modifications to the plan design to get that increase down. So again, the HMO plan, the core benefits mirror the current PPO plan, but there is no out-of-network coverage except for emergency care. We have a $4,500 deductible, $9,000 family deductible. The office visit copay is $40 for a physician, and $60 for a specialist. Urgent care copay is $75. Telehealth, which is like MD Live, copay is $40. Preventive care, routine lab, and imaging are all paid at 100%. And we have prescription coverage with the HMO plan as well, with copays of $15, $40, and $70.
Kim, what do those how do those deductibles compare to last year's?
The deductibles are exactly the same.
Okay.
So if you remember, last year we went up on the deductible, but this year we kept the deductible the same.
Okay.
Okay, the PPO plan, this is our current plan that we have. It has a $4,500 deductible, $9,000 family deductible. Again, these are all the same benefits that are on the HMO plan that I just talked about, but this plan has out-of-network benefits as well. Okay, so the history of the city contribution to dependent coverage. So even though the cost of coverage increased, the dollar amount contributed by the employee for the dependent stayed the same since FY 2016 and was less than 2014 and 2015. So the city has absorbed the increase each year. And this year, FY 2025, we are contributing 75% of the dependent cost. And each year it went up a little bit because of the increase that we had. So you can see 24, we had a 73% of dependent cost, 23, 68, and so on. Staff's recommendation for the medical is for the following reasons. Staff recommends staying with Blue Cross Blue Shield and adding the HMO as the preferred medical option instead of the PPO as the preferred option. It is well received by the area medical community, stronger provider network in Kerrville, stability of our 12-year relationship with Blue Cross Blue Shield. So this year, FY 2026 will be our 13th year with them if y'all approve this. A high satisfaction rate among our plan members, and then employee and their families know the Blue Cross Blue Shield plan and how it works. Are there any questions on the medical part so far?
I just want to reiterate that for those who want to stay on the PPO, they can. It's just a higher premium for that
Yes.
plan
Yes.
than the HMO. So you still have the option of going either to the HMO or staying with the PPO. But
That's correct.
the price would be different.
Yes.
Okay.
Yes. There's a little bit of an increase, and we'll talk about the contributions to the percentage contributions to each plan in just a few minutes.
Okay.
Or we can go to that now if you prefer.
Oh, it doesn't matter.
Okay. Okay.
Kim, let me jump back real quick, just for clarification too. Do we have a way of tracking what happened in January?
Yeah, I was gonna ask that.
I mean, we go from 37.4% to 200.2% the next month.
A lot of flu or what?
Well, no, that's all HIPAA information, so we can't get information like that
Okay.
about what happens. A
Okay.
lot of the claims historically are spouse claims, which is why we're recommending that we decrease the city contribution to the spouse claims when we get further into this.
Thank you. I figured it might be
Did you
HIPAA.
want to add
but-
anything? That's the reason. Yeah, they don't tell us. They just give us numbers because we can't have the medical information on
Right.
people.
Thank you.
Yes, sir. Okay, so dental. MetLife, which is our current provider, came back with a 7% increase with the same plan as current. Blue Cross Blue Shield came back with a 0% increase and a 2-year rate guarantee, and they offered to give us a 1% discount on medical if we went with their dental plan. It's the same exact plan design and everything. Lincoln came in with a 5% reduction, same plan as current, but there's potential network disruption. So some of the dentists that are in network on Blue Cross Blue Shield would not be in network on Lincoln. So therefore, our recommendation is to change to Blue Cross Blue Shield to leverage the additional bundled savings for medical. They've been a previous dental vendor for the city in '24, and then regain a couple of preferred dentists as in-network. And this is the plan design. The city would contribute, we're recommending the city contribute 100% of the cost for the employee and 17 to 18% of the cost for dependent coverage, which is the same that we are doing now. The details of the plan design: $50 deductible, $150 family deductible that's waived for preventive, which means you can get 2 of your 2 teeth cleanings per year free. $1,500 annual max benefit, $1,500 orthodontic lifetime maximum for children only. Preventive services are covered at 100%, basic services at 80%, and major services at 50%. And the city and employee contribution remains the same as the current year. Any questions on dental? Okay. All right. The city paid life and AD&D. Blue Cross Blue Shield is our current provider. They came in with a 0% increase, the same plan as current. However, Lincoln, who we've used in the past, came in with a 0.15 reduction per $1,000 of covered monthly payroll and a 3-year rate guarantee. So we are recommending that we change to Lincoln, mainly for the 3-year rate guarantee, enhancements to the employee and spouse benefit maximums on supplemental coverage, and then slight savings to the city on the annual premium. And this is what the plan, there's a little bit of a delay. This is what the plan is. It's employee-only coverage for the part that the city pays. They have 1 times their base annual salary, the maximum of $50,000, accidental death and dismemberment, payment based on severity of disability or dismemberment. The cost is per $1,000 of covered monthly payroll, and we show 323 covered employees currently, times $32 is $10,336 to have this benefit for our employees. Any question on that? Okay. Moving along to long-term disability. Lincoln, which is our current provider, gave us a 0% increase, the same plan as current. And then if additional lines were added to this, the life AD&D and the short-term disability, they would give us a 0.08 reduction per $100 of covered payroll with a 3-year rate guarantee. Blue Cross Blue Shield was 0.4 reduction, and MetLife was 0.08 reduction. We recommend that we remain with Lincoln for ease of transition from short-term disability to long-term disability, and the 20% savings for the city. And then this is that plan. It's a maximum monthly benefit of $10,000 or 60% of your base monthly salary. Elimination and waiting period is 90 days, which is your short-term disability time period. The max benefit period is age 65 or Social Security normal retirement age, whichever is later. It also includes an employee assistance program, which we need for counseling services and other services for our employees. The cost is $0.219 per $100 of covered monthly payroll. We have 323 covered employees on this plan times 150, which is $48,450 for the long-term disability plan. Any questions on that?
You had given us some new numbers, and that's not the 14. I think you had a 340-something employees. Is that different?
Yes, well, we're going to talk about that in just a minute. All right, moving along. Okay, so our core benefits, which we've just talked about, are our medical, dental, life, AD&D, and long-term disability. And this is the slide that tells us how much we are contributing to the employee and to the spouse coverage. So on the HMO, we would contribute 100% to the employee cost, 55% of the spouse cost, 75% of the child cost, and 70% of the family cost. On the PPO plan, we would contribute 89% of the employee cost, 45% of the spouse cost, 55% of the child cost, and 55% of the family cost. On the dental, it's the same as what we're doing now, 100% of the employee, 17% of the spouse and children, and then 18% of the family. And the life and AD&D and the long-term disability, we contribute 100% of that cost. We also have voluntary benefits that employees can get, and they can purchase that 100%. They pay 100% of the cost of that. That is vision, and we have the same plan design and the same rates as we currently do for the employees. The supplemental life and AD&D, the same plan design and the same rates. Short-term disability will be lower rates, a 2-year rate guarantee, the same plan, and then EAP access, and AFLAC and MASA would be the same cost as well. So as you can see, some of these voluntary benefits are going to save the employees money too. Any questions on the voluntary? City doesn't contribute anything to these. I just wanted to let y'all know what we offer to our employees.
It's good to know.
Okay, so cost of benefits. We calculate the cost of benefits per employee per year, PEPY. So the city contribution to the cost of benefits for medical is $12,001. Depends on the tier of coverage. So if we have people that switch tiers of coverage, that's going to change. And we have people that switch tiers of coverage all the time. So somebody is single, they get married, they add their spouse. Somebody's single, they get married, they add their baby, or add their spouse, then they add their baby. They get divorced, they take their spouse off. It's a constant thing. So that's what it was whenever I did this PowerPoint. Blue Cross Blue Shield Dental is $393 per employee per year. Lincoln Group Life and AD&D is $32 per employee per year. The long-term disability is $150 per employee per year, for a total estimated of $12,576 per employee per year. So this is for you, Councilmember Seigerman. The budget benefits for all full-time positions approved by council. So there are 347 positions, and again, vacancies occur during the year, monthly billings vary, and all that. So we've not had a full staff as long as I can remember. We've always had vacancies. So our benefit reserve balance as of July 16th was $319,220. That changes due to constant changes in number of employees due to new hires and terminations, employees changing benefit plans at open enrollment, and employees changing coverage and plans due to life status changes like what I was talking about, marriage, divorce, babies, etc. So for our benefit budget, we take the total estimated cost of benefits, which is $12,576, and we're requesting that we budget $12,900 per employee per year. And this is higher because medical bids are based on 322 employees. The dental bids are based on 321 employees, and these are actual employees on the plan right now. Life and AD&D short-term disability are based on 323 employees, and we're budgeting for 347 employees. So if we are ever fully staffed, we will need funding to pay the city portion of the benefits selected by the employee. If we over budget, that money goes into that benefit reserve. That's how that benefit reserve is created. And then changes that cannot be predicted. I mean, we don't know who's going to get married or who's going to get divorced or anything like that. So, and we would also request that the council authorize us to use the employee benefit reserve if needed to pay for any overages, if we have any overages. So the action to be taken for this, staff recommends council, and you have to do it like this: acting as the trustees of the City of Kerrville Employee Benefit Trust, approve the FY 2026 employee benefit plans, rates, and funding as presented, and authorize the city manager to execute the contracts with the providers. And I'm happy to answer any questions that you might have.
Well, I just want to say thank you for producing this report through all that you've been through. I mean, pulling it together kind of at the last minute, because that's how much time you had left to do this.
Yes, ma'am.
I applaud you.
Thank
And if I was younger, I might apply to work here, because I think this is a really good package. But that brings another question to mind. You showed me kind of where we fit in comparing to other cities.
Yes,
I
ma'am.
don't know if you planned to talk about that, or if you could.
I certainly can. We did a survey of a lot of other cities. I have a spreadsheet that's like this big that Maya did, that's like this. I swear it is really this big.
I
We could
saw
put
it,
probably
yeah.
on a poster board. And where we are recommending that we go is the 55% for spouse. Do you want me to name cities?
Well, maybe just 2 or 3 or 4.
Okay,
No,
Bernie
comparable.
contributes 42% for spouse coverage, and 42% for children, and 42% for family. We're recommending 55% for spouse, 75% for children, and 70% for family. We're only recommending that because we've been doing 75%, and we're going to ease our way down to where to where we need to be.
Got it, yeah.
But we don't want to do it all at once, because that would be hard on the employees.
Thank you.
Fair Oaks Ranch is 55 straight across the board, so, and then Hondo is 50% straight across the board. Any other questions?
Questions or comments?
Yes, I'm trying to find it real quick, I'm sorry.
Okay.
So I see in your fiscal year 2026 benefit budget, you have short-term disability bids, right there,
Okay.
right after the AD&D. But I
Yes.
didn't see that back here in the recommendation. I just saw long-term.
Because short-term disability is employee paid.
Okay. I just wanted to make sure that was
Oops.
the fact, so, I'm sorry, or the case. 'Cause
Yes. Sorry, I should have made that say long-term, not short-term.
I just, sorry, just wanted
That's,
to ask
that's one
because
of those last-minute mistakes, sorry,
well,
for not having the,
I know you've been busy with
Time.
everything else, so thank
Yeah.
you, so.
change short to long.
Any other questions or comments? If not, I would entertain a motion. And we have the actual wording of that motion paraphrased at the bottom of that.
It's on the screen now, should be.
I'll make a motion that we, staff recommends council acting as the trustees of the City of Kerrville Employee Benefit Trust approve the FY 2026 employee benefit plans, rates, and funding as presented, and authorize the city manager to execute the contracts with the providers.
Second.
Motion's been made and seconded. Any discussion? All those in favor, so vote. Passes unanimously.
Thank you very
I
much.
want to
Thanks for all your work.
I want to say thank you for, I know this is a huge job. Thank you for getting it done. I thank you for taking care of the people who take care of our city. Thank you.
Yes, sir, thank you.
Kim?
All right, there's no other business on this agenda, so I'm going to go ahead and adjourn the City Council Employee Benefit Trust at 4:22. Our next meeting begins at 4:30.